Dr. Shari Caplan here from VitalityMD. We're going to have a little chat today on lichen sclerosus. It's one of the specialties that I've taken interest in and see a lot of patients with LS, and I think I've made big differences. I've do PRP or O shots for patients. I've created a new study that's looking at radiofrequency microneedling and then using exosomes, PRP, or a combination. And I have with me today one of my patients who has been suffering with LS for quite a bit of time and has seen a lot of specialists and wasn't getting the help she needed. And then she found me. So welcome. Thank you for doing this
Of
video because I
course.
know a lot of patients are always, don't want to really talk about it or
hmm
they're embarrassed. But
hmm
I think that you doing this today is amazing because so many women suffer in silence. So the more that
100%.
we can talk about it, normalize it,
hmm
and say that there's help,
hmm
I think that's huge.
Absolutely.
So how long ago were you kind of diagnosed with?
Yeah. About 3 years ago, I was diagnosed. And when I was first diagnosed, I actually looked at Vitality MD when I was Googling what it was entailed, and I found you, but I didn't come to you right away, and I regret that wholeheartedly.
And if anything, you've seen gynecologists and whatnot, and then they've given you treatments, and one of the standard treatments is
Absolutely.
clobetasol,
Yep.
and it works in some cases, but in others, it still may not help prevent
Yes.
scarring or pain
hmm
and whatnot. And
Hmm.
then actually, there's a lot of things about lichen that I'd like to talk about because a lot of people actually get misdiagnosed or they go years without diagnosis. They often present with itch and they feel like they have a yeast infections. A lot of doctors will just treat and then not really look. And even if
hmm
they look, they don't even know what lichen looks like. So it goes a long time without being diagnosed. What we kind of know is sometimes there might have been initiating a bladder infection, a yeast infection, and now we're actually seeing a lot of patients developing LS after COVID or
hmm
COVID vaccine. And also then we're seeing that lichen can flare after bad viral illness, stress,
Absolutely.
and stuff like that, and that there's often one other autoimmune condition that the patient may have. There might be a family history. So we're learning more and more about lichen. And I just want to talk about like what your experience is
hmm
having lichen, because a
hmm
lot of women will say that it's all encompassing. It's on their mind all the time. They're feeling
Yeah.
uncomfortable.
Yeah. Before seeing you, absolutely, it robbed me of my sexuality. It robbed me of my life. It robbed me of my motherhood. This came about shortly after having my second child, and then also getting a COVID vaccine as well. So um, chicken or the egg, but yeah, it didn't allow me to be present with my children, and that was heartbreaking for me. Instead of focusing on them and being present with them, I was in my head, and I was not able to be intimate with my husband. And that was one of the first things that allowed me to figure out that there was something wrong, because since having my second child, sex hurt, and
Right.
that was not normal.
Right, and that's huge, right? In couples, especially after having a baby, like it's always on pregnancy, and then the baby and the husband and wife kind of lose their intimacy, and then
Absolutely.
to on top of that have a condition down there that makes sex painful, and that like you want to actually avoid it because it
Yeah.
hurts.
Yeah. Absolutely.
So when you came to see me, tell the people like what was your experience and what did I do for you and what did you find helpful?
Yeah, I mean, from the very get-go, I felt that I was in good hands. Everybody at Vitality MD is so wonderful and friendly. It's anything relating to my health, I'm very anxious about. I don't like to share, like you said in the beginning, embarrassed about it at times, depending on what it is. So I never felt embarrassed since being here. I felt very comfortable. Your staff has and yourself, you've normalized it. I feel like I'm in good hands. And I started noticing a difference from my first treatment.
And you did the LS
I
study
did the
that I
LS
was
study.
conducting, and
Yeah,
that's what you had. Basically, it's 3 treatments
yeah,
done quite quickly
yeah.
over every 2 weeks for 3
Mm-hmm.
sessions,
Mm-hmm.
and you had results very quickly.
Absolutely. So I was originally prescribed by 2 gynecologists and 1 vulvar specialist, the gold standard of LS treatment, which is clobetasol. And I kept on telling all of them, this isn't working for me. Um, I was applying the steroid treatment in accordance with Gillian Kraft. I was soaking beforehand. I was being very meticulous about my approach to my condition, and I wasn't finding it helping. For me, to be able to see results from the first treatment with you was mind blowing. Like, it actually gave me a sense of hope that I completely lost.
Right.
Yeah.
And an illness can occasionally make it flare, but
Mm-hmm.
so you come in for a treatment every once in a
Absolutely.
while,
Yeah.
but you have to say that you're so
I'm so
happy
happy.
and being able to be intimate again with your husband,
You've
right?
given my life back. You've given my life back to me.
Well, thank you
Yeah.
very much. I appreciate it. And, if you're suffering from lichen sclerosus, or you feel that you may have symptoms and you're not getting diagnosed, book an appointment at
Mhm.
VitalityMD.